So, my guest today is Dr. Tabatha Barber, and she has devoted her life to giving women a voice and a choice when it comes to their health and well being. As a young girl, she struggled with self esteem and identity issues, dealt with peer pressure, and survived the ridicule and stigma of becoming a teenage mother. As she shared in her first published book titled From White Trash to White Coat: The Birth of Catherine's Purpose, those events led Tabatha to finding her purpose in life. With perseverance and grace, she was able to redirect her life path and become a successful physician. So amazing. Tabatha is a triple board certified in obstetrics and gynecology, menopause, and functional medicine. She has the unique situation of being licensed to practice medicine in over half the country, so you now have the ability to work with a functional physician virtually. She is the host of the Functional Gynecologist podcast, where she shares her wisdom and knowledge with women everywhere to reclaim their health. She is also a keynote speaker, mentor, wife, mom, and grandma. By incorporating functional medicine into her women's health practice, she was able to provide women with the tools they need to optimize their health and happiness, which in turn allows women to pursue their purpose in life. You know, I read a lot of bios, and that's a pretty good one. That's a pretty impressive
Oh,
one.
thank you.
That's really awesome. So, yeah, I mean, I love the name of your book. It's just so punchy. I
Well,
guess
it's the truth.
I guess the first question I want to ask you is when and how did you get into functional medicine?
Yeah, so oh gosh, it must be 4 years now. I was in full burnout mode. I could barely function at work. I was falling asleep at lunch at my desk, just I was in survival mode. I wasn't sleeping. I was delivering babies all night. I was eating whatever was in the break room, which was usually donuts and coffee, or a birthday cake or whatever garbage was laying around. I had no memory. I relied on my assistant to remind me of everything. Like
Mm,
literally, I could see a patient and not remember the next day that I had seen them. And I finally had a back injury and was unable to function. And that was kind of my breaking point. So I had surgery, took 6 weeks off to recover, came back and re injured 3 days later, and I
wow.
couldn't move. And I said, something's got to change. This is not right. They wanted to give me more surgery. They wanted to put hardware in my back, the whole bit. And I said, I'm going to take 4 months off of work and really figure this out. And I found Mark Hyman and Amy Myers and Melissa Urban. And I just started reading and listening to podcasts like a maniac. And then I found the Cleveland Clinic Institute for Functional Medicine. And I just dove in. I just started taking every course. I started studying everything I could. And once your eyes are open, you can't go back, right? I tried to go back
Mm,
to work and see patients in 15-minute spots and hand them a prescription, and I couldn't do it. I wanted to know what they were eating and what kind of stress they were having. I was like wondering about mold and heavy metal toxicity, and all of these things are running through my head. And meanwhile, I'm expected to just hand out pills and schedule surgery. And so I didn't last very much longer after that. I think it was about 6 months, and I finally just changed my entire life. I gave up my cushy salary job and my 401k and all that stability and security. And I said, I'm going to just go out on my own and practice functional medicine. I gave up being a surgeon and delivering babies. It was life changing for me, but
mm.
that's how strongly I believed in it because it works. And it's been the most rewarding thing I've ever done. So, of course, I'm so happy I did it, but it was definitely a bit of a challenge, but I'm used to challenges. So that's okay.
I feel like I should start a series called like Woke MD because I think Kieran Dunstan, who you know, we talked about that phrase, and I just thought it was so cute, and I love you guys. I mean, I have respect for all MDs. It's so much work. But the ones who are like, going back to school later on when they're so busy to learn more more, to keep asking questions, change your career. Like, I think it's amazing. So I'm going to start a club for you guys. You can be in. I just had a great, I'll have to share on Instagram. I interviewed this great neuro ophthalmologist yesterday who kind of similar story, right? If you go through a health crisis, you have to start asking more questions. And I share with her, it's even the same for me. I was from the background of Chinese medicine. It's an amazing practice, but I was getting sicker and sicker. I didn't know it was mold, but I just had to start asking questions, right? I started studying functional medicine, which is, I think, where we tend to end up when we have unanswered questions, because functional medicine does do a pretty good job of answering those questions, right?
Yeah, and I really just want everyone to understand, like, you can't even be mad at your conventional doctor because they are in this broken system and they are probably struggling themselves to, they're in
Yeah.
survival mode as well. Like, I literally did not have time to read or look outside of my, one main society, American Academy of OBGYNs, and like the required stuff that I had to do because I was so busy and so exhausted. And so it's like you can't even be mad that they don't know the latest research and they're not keeping up on it. They're in survival mode. So I'm on a mission to break that system and help people realize, like, there are answers. You have to step outside of conventional medicine, and eventually I want to help conventional gynecologists get these functional tools and understand that the Band-Aid approach is hurting women. It's not that it's not healing us, but it's actually causing new problems and making your current issues even worse. So I want to shed light on that and just make it clear, like, if your doctor doesn't get it, it's okay. You just got to go somewhere else for now.
Yeah, it doesn't have to be like a big judgment. I think that's is important. It's just choices. So I'm curious. I don't know how old you were when the back injury started and stuff. Do you feel like now looking back, like hormonal imbalance was at play?
Oh, without a doubt. So stress was the major driver, and my poor diet. Like, my gut health was absolutely horrible. I think I pooped like once a week. I was always constipated, always full of toxins. My cortisol level was through the roof, and I had really strong estrogen dominance. So at the same time that I had a back injury going on, I was having crazy heavy periods. I was like emotional roller coaster. My breasts hurt all the time, and conventionally trained gynecologists aren't really taught about hormones. We're surgeons, we spend 4 years doing surgery, not learning how to balance
Wow.
hormones because we're trained to look for disease. We're not trained to look for imbalance. And so, unless you're like off the charts, we just tell you you're fine. I mean, I'm just being honest. And
Yeah.
so it didn't even occur to me that heavy periods had a root cause to them. All I knew was you get birth control pills or an IUD or an ablation or surgery. And those are my options. And I actually went through those with my own gynecologist and ended up bailing because I had two C-sections, and she was going to do the ablation. And she said, all this already, but just to remind you, you might end up with a hysterectomy. You might end up with a bowel injury because that scar on your uterus from your C-sections is really thin, and that burn could go through and injure your bladder or your bowels. And when she said that to me, I was like, time out. I'm not signing up for this. And mind you, this is conversations that I had with patients every single day, and I just thought it was no big deal. You just need your ablation or your hysterectomy. And when it came time for me to have it, it really was like a slap in the face. Like, wait a second, this is kind of a big deal. I don't want to have this major surgery.
It's permanent. Yeah.
Right. And that's when I was studying like gut health and all this other stuff in functional medicine. And I was like, there's got to be a root cause for this hormone imbalance causing these heavy periods. And then I really started diving into studying hormones. And I just found this whole world of information, and I just, once I started researching, I couldn't stop. And I was like, oh my gosh, I don't need to have heavy periods and I don't need surgery. I don't need to remove my uterus to fix it. I need to
Mm,
get my stress under control. I need to get my liver functioning. I need to clean up my gut. I need to stop eating out of plastic 24/7. Like, there was so many things and I healed it all. Now I have
wow.
nice regular periods that are manageable and they tell me how my health is every month. And I avoided that second surgery. So it's just amazing what you can do when you actually take care of the root cause, right?
Mm. So you mentioned some root causes there that you experienced, and then like how it manifested, like estrogen dominance, heavy periods, moodiness. What other patterns do you see now that you're working as a functional gynecologist?
So it's super common for us to put girls on birth control as soon as they start having periods, 12, 13, 14, 15. Soon as they start to have uncomfortable periods or irregular periods, we're giving them synthetic hormones. We're giving them pills or depot shots. And all that does is turn down your own hormone production. So you're using these synthetic hormones, and women will be on these and then they'll want to go off and try to get pregnant and they won't be able to get pregnant. That's a really common thing I see. Or they'll get pregnant, they'll go back on them. And then in their 40s, oftentimes things shift and they can't tolerate those synthetic hormones anymore. They're getting headaches from them and they're having
Mm,
breakthrough bleeding and irregular periods. And so then they go down this trail of, let's try the Mirena IUD. Let's do the endometrial ablation. Let's end up with a hysterectomy. And what I've come to piece together is that the women on that path, about 3 to 5 years later, end up getting diagnosed with breast cancer. And so in my mind, it makes sense that you have had this hormone imbalance for many, many years. You've been on synthetic hormones, and then you have estrogen dominance. And that's a classic setup for making too much 4-hydroxyestrone, damaging your DNA, and increasing your risk of cancer. So I
mm,
would really love for gynecologists to just take a minute to realize that some of this is really preventable, and we might be contributing to the increased risk of numbers because we're ignoring the warning signs. Symptoms are a
mm,
major warning sign from our body. Our body is trying to yell at us and tell us, hey, something's not right, something's not metabolizing, something's not functioning well. And what we do is we just keep ignoring it. We keep covering up the symptom and not listening and figuring out what your body's trying to tell you. So I think that we could prevent so much if we would just approach things in a totally different way.
mm. That's really powerful what you explained. So it sounds like, well, we tend to estrogen dominance at a certain age, but then with our diet and everything, we're going farther into it. Instead of like getting to the cause of it, we just cut stuff out or mask it. And then that's pretty scary that you see that's ending up in more estrogen like induced cancers. It's really scary. I don't think women want to go that way. It's too bad that more people don't know. Hopefully some people will find this video and your podcast. I wonder for people listening if they're like, that's me. I'm getting towards menopause. I'm having heavier periods. My doctor just recommended something like this last week. Like, how can they pause the process and get like a better diagnosis or a functional assessment?
That is a great question. So I always say test, don't guess. Like, get a Dutch test. A Dutch test
Mm,
is dried urine comprehensive hormone testing. So it will not only show you how much hormone you have at that time that your body produced, excuse me, but it will show you how your body's metabolizing it. Is your liver efficiently deactivating it once you've used it and removing it from your body? Is it getting reabsorbed? Is it getting turned into intermediate metabolites that damage DNA and increase your risk of cancer? All of that information is totally at your fingertips, yet
mm-hmm.
conventional gynecologists don't recommend it because it's not covered by insurance. It's not a test that, you get a diagnosis and you get this test and insurance pays for it and you get this prescription. Because it doesn't fit in that pattern, it's outside the world of conventional medicine. It's a, standardly used test widely around the world for functional doctors, integrative doctors, anti-aging doctors. It is super valid. It's a game changer. Like when my patients get these, we get so much information and then we can see, do you need liver support? Do you need to heal your gut? Do you have genetic mutations that are preventing you from handling your hormones? Do you need hormone replacement to balance out other hormones? All of these questions get answered. So I love doing the Dutch test, and it's definitely something any woman can get their hands on. And so if you figure what's going on with you and not just guessing or assuming you're fine, like that can be a game changer. I would love to just share, like I had a patient who was also a friend. She was a fellow OB nurse and she was a third shift worker. Night shift workers have a high risk of cancer.
Hmm.
And she developed breast cancer. She did the double mastectomy, the lumpectomy, like the whole bit. She got put on tamoxifen to suppress any estrogen after that because she was only in her 40s. And she just mentioned to me one day, I'm having periods again. Do you think that's okay? And I was like, not really. If you're taking a medication that's suppressing your estrogen, you should not be growing that lining of your uterus and having a period. So
Hmm.
we did the Dutch test, and her 4-hydroxyestrone, which is the bad metabolite, was extremely high. And so it was all being driven by the extra weight she was carrying, because unfortunately, our fat cells will aromatize testosterone into estrone. And so that can contribute to it. And tamoxifen really was not preventing that. And her third shift lifestyle and her chronic cortisol dysfunction, so her circadian rhythm was all off, like this was all contributing. And um, so I just felt like that's a really big deal, because you just assume this medication is preventing reoccurrence and protecting you when in fact it was not. And
Wow.
since her, I have seen at least a handful of other women with that same scenario. And unfortunately, the oncologist says, oh, you're fine. You're on the medication. Just make sure you take your medication. But this is how recurrence happens. And so I just want women to not accept everything their doctor says as, 100% solid, because they don't have all the answers and we're all individualized. And it's okay to speak up if something doesn't feel right in your gut. Like my friend just knew, like, this doesn't make sense to me, and she had enough smarts to say something. So I would encourage women to, like, not be afraid to question your physician. Just because they have the white coat on doesn't mean they know everything, because they don't live in your body. And so if you're not comfortable talking to that physician, find somebody else, because you should be able to ask, medication working? Do I need this? Should I be on this for the rest of my life? Things like antidepressants, we hand those out like candy, and there's no end in sight as to, is this going to fix me? Is this actually going to help me? And so I just want women to not be afraid to say, why do I need this? How long do I need this? Are you sure there's no other way? And, you know, and go from there.
I like that. Yeah, I have a client fits almost that exact same scenario that you just said. So I'm gonna send her this recording and your resources because we do some of this work, but you've been doing it really intensely. So I'd love for her to learn from you as well. So we had a question in the Q&A, similar to what you're describing. She said, I was on the depot shot for 20 years, followed by progestin only birth control for nearly 10 years. Quit taking it a month ago because I want to have my hormones tested. Great. How long should I wait after stopping birth control before taking a Dutch test to get the most accurate results?
Oh my goodness. So, one thing I do want to mention, the depot shot, the synthetic progestin that like slowly releases, it's the 3-month shot, so it gets released every day. That has a black box warning on it that it thins out your bones. And so if you're on it for longer than about 3 years, they recommend getting a DEXA bone scan to see your bone density.
Wow.
And so that's really important for women to know, because I don't think that's getting addressed the way it should and being talked about. Like she just mentioned, she was on it for wow, 10,
20
20
years.
years, like yikes. I really don't want her to have a hip fracture. So get a bone density. And I would wait at least a month, try and see if you have a cycle. You probably won't when your brain and ovaries have not talked to each other for decades. They don't usually jump back online and start communicating that quickly, if ever. But I would say if you give it a month or two, what's going to happen is probably going to happen. If you're only on it a couple years, then that communication might come back online. But I would say 20 years, that's a long time. I'd be very surprised if you started having regular periods again, because that communication has just been shut down for so long.
So the Dutch, if you are premenopausal, usually recommended for like day 20 of your cycle, but postmenopausal can be like any day, right? Because if you're no longer cycling.
Exactly. So if she comes off of that and she doesn't have any kind of bleed, for 30 to 60 days, just do the test. You're going to get
Okay.
some good information.
Okay. I want to watch your timeline, but there was another good question here from Kirsten. She said her mother-in-law wishes she had started bioidenticals earlier when she went through menopause. She's now 74. Is it too late to start if her hormone levels are low?
So the research is pretty clear that about 7 to 10 years past your last period, the risks do go up with hormone replacement therapy. So you have a higher risk of blood clot and stroke. Those are the main ones, or worsening cardiovascular disease if you already have that. So in situations like that, we may not start systemic estrogen, but we'll often do local vaginal estrogen because it's super beneficial for the vaginal tissue and for bladder support. A lot of women that age have recurrent bladder infections or leakage of urine because they don't have enough estrogen in that area. Intercourse is painful. So we'll do like a vaginal estrogen. And sometimes we'll do a little bit of compounded progesterone and testosterone cream. That doesn't seem to have the same elevated risks. Now, I'm talking bioidentical, obviously, only natural progesterone and estradiol. But in those cases, she could have some real benefit from that. So I would say find somebody who knows hormones, who does it on a regular basis, and get some relief for her.
Well, that's great advice here because it's not just like a hard no. It sounds like if like it can be, it can happen if you're careful and do the right thing. So Dr. Tabatha is someone who could do this. And she mentioned in her bio she can see people in many states. There is this free guide here too that you can put in your email and get her guide, which I'm sure is awesome. And then there's information on scheduling an appointment. The podcast is on here, and it's just drtabatha.com.
Yeah, I just rebranded to the Gutsy Gynecologist Show. So my podcast has a new name, but yeah, definitely check me out if you feel like you need a licensed physician. My assistant can let you know what states I'm licensed in. You just, sign up for a little discovery call with her and she'll answer all your questions. She's fabulous.
Awesome. I'm just checking out your detox program too. I support that. That's awesome.
Exactly.
So that's drtabitha.com, and we'll have it. I think there's one more question or comment, but I know you have to go. Do you want to answer one more, or you want to get going,
I can do
Tabitha?
one more quick one.
Okay. This is just the person with about the Dutch question. She said she had a cycle after quitting birth control, but it hasn't come predictably regular yet. Is there an over-the-counter test that I can use to make sure I'm taking the Dutch at the right time?
So you can do ovulation predictor kits. So you get those, and if you have no idea, like you haven't had a period in 35 or 40 days, you can try to guesstimate and start taking those every day and see when you ovulate. You might go through a whole bunch of tests before you actually ovulate. So in that case, you might want to monitor your basal body temperature, save yourself some money. And your temperature will go up by a degree when you ovulate. So the key is to take your temperature as soon as you wake up. You don't even get out of bed. You don't put your feet on the ground. You take your temperature in bed. You do that every morning and wait to see the rise. So you could do that, or you could do the predictor kits. They will show you the same change. And then you count usually 5 or 6 days after that, and then you do the test.
Yes, yes. So that's like as if you're trying to get pregnant. That's usually when they're teaching about basal body temperature, and you can usually buy a little pack of ovulation predictor. You just pee on them like a pregnancy test. So I think if you want to do that, great. And honestly, I think if you just sent it in, it's okay too. Like, just depends on what you want to do with it, because I think it gives you great information. Even if you're not totally sure where you're at. Would you agree with that, Tabitha? Like, you're still going to get benefit.
Well, there's actually a cycle mapping version of Dutch. And so
Right.
if your periods are consistently inconsistent, so if they're usually irregular, and you really want to do this for fertility, I recommend doing cycle mapping, where you're taking samples throughout your entire month, and then they will like plot on the graph and show you your changes in your estrogen and progesterone and stuff. So it kind of depends on your reasoning behind
Your
it, your
goal.
age, your
Yeah.
goal, all of that stuff. DutchTest.com is really cool about explaining all that. It's a good resource as well. Um, but I love the information. I think it's so helpful. And if you want to look at your cortisol pattern, right, your stress hormone over a 24-hour period, you can test your saliva and your urine to get that pattern. And that's really helpful to understand, because that drives a lot of dysfunction.
Yeah, it's a great test. I'm glad you use it. It's actually on sale if you happen to be like live. It's on sale for us through the weekend in honor of our mold master class. It's our number one selling test. It's a hormone test. It's not a
Good.
toxin test. Yeah, people love it. And you could bring it to Dr. Tabitha for a second opinion too. We can't prescribe hormones, so we can review your results and talk about diet and lifestyle, but we can't. There's only so much we can do. So that could be a fun option. Well, thank you so much, everyone, for being on. Tabitha, it was a really interesting interview. Thank you so much.
Thank you for all your work you're doing. This is awesome. I'm so glad you're getting the word out.
Yeah, well, thanks for coming on, and we'll see. I think you guys, I have a week off next week, and I will be back next week. Appreciate it. Bye, everybody.
Bye.